All right, sorry for the challenge. But you're not yet also. Now, you're afraid you're be toxoscar. Actually, you're friend of toxoplasmosis. Now, and more be a friend of toxo. Anna, it's me edeba. Let me mute your. All right. Now, you're afraid to be toxoscar. A conditions be one of my a buy an inachi. Where we heard near chia. Sin I was when near the normal way, sin I was say. Now, when there's toxoscar, where near Wahasi, when near Waha, never near Sayawaha, very dangerous condition. Very, very dangerous. Now, me say, in at least we like taking meat. Now, one thing I say, Abuana, Wakuna Berin, and Okotona Berin. Winning baby, you could free. It my experience, 2 cases in 1 day. Omuna buy a more toxo scar. Now, commodity demono, Bako Chairman said, Ope, Chinchinga, near Butchi Fona at Tunibino. They told me that. And I'm also a Casaf Chairman for a Nam. Now, one thing is this kind of toxoplasmosis, no, to cut a long story short, min can't quench it baby. If it is meat, make sure it is well cooked. Make sure that a nam na one a being Anna men coming into contact with cat feces, a jinamwa, ni feces. Make sure you refrain from that. Don't come into direct contact with cat feces and refrain from eating uncooked, or let me say undercooked. I won't say uncooked. And nama I mean they can the organisms in the toxoplasmosis go in there. They can travel and go to the back of the eye and cause serious damage to the eye. Okay? When it happens, vision becomes blurry. You wouldn't see anything again. I didn't say because of and I'm being. And now Nintameka and say the abuana yakuno. When you be a and they trap all these kind of organisms from their side where they feed. Into winning baby, Mgasa abuebe now because abuaning in that organism now. A parasite infection. Into to cut a long story short, make sure it is well cooked. Don't eat on undercooked meat. Because the organisms will still be there, and they're going to travel, go to the back of the eye, and cause serious damage to the eye. Going to cause this kind of patches called toxoscar. Treatment here becomes very difficult. Even anesthetical procedures, it is much difficult. It's messy. Say, they are preventable diseases. I did everything I prevent it. Yen came an answer and I promote solutions. So coming into direct contact with cat feces can result in this. Eating undercooked meats and nama am being ye who result in this. I don't say wishing when you offer and I've counted numerous number of cases on such problem. So please let all refrain from eating undercooked meat and then come into contact with cat feces. Some pokabaya eat fish. Sankabaya just taking fish to avoid all this. This is toxoscar. All right. Now, you have something called here pterygium. Pterygium. Now, pterygium, no, me share obiania. No one is say this is the eye of someone. Let me say a patient. Once in an infitano, any echo to so. Any. This is called pterygium. And so, anyone can say any pterygium me ever. Until we can prevent this pterygium. Now, and now been a cool result. Now been a bit medicine. Now, eye irritation from hot and dry weather, wind, dust, smoke, the sun, long-term exposure to the sun UV mostly. if you say there is no actual cause of this, but research I gather intelligently I confirm say most of them may cause this kind of pterygium. Ebema when if itano ebenya kotuntum so long-term exposure to sunlight, because the sun contains UV radiation, UV light. And when we have direct contact with them, it becomes very a problem. Until where market women are, most of the market women no obedient way now, but a nimba tuntum so bebrena be ana farmers no we call foam we money and dust in south smoke man form no aduane dust smoke when we na contribute to this kind of disease. I find pterygium. And you want the causes, I think say it makes a lot of suggestions and say it better me I refrain from this. Tell me say eye diseases no, they are preventable. That means say any baby na one ma better me refrain from it unya. But if you have little or no idea, you go much into the causes, and at the end of the day, it's going to result in this. The only treatment option here is excision, surgery. A bit of surgery near rare we never somehow. But naka under simple refraining from all these causes, a bit refraining from getting all this kind of thing. In the whole causes now, but to me a pass say a free neque, now direct contact with the sun. And I say when for example, there's kind of it's too scorching and say it is too high, that the UV radiation that becoming to you is too high. Having direct contact with the eye going to cause all this. Kitchen smoking, we say resulting to all this. So please, let's get to know the causes of this. And we know most of the population when any white man very dangerous. So please, let's get to know the causes. Young causes here, a bit me a refrain, smoke, dust, wind, and then mostly the sun. Direct contact. And I see baby the UV rays coming from the sun contributes a lot to get this kind of eye condition called pterygium. So please, let's refrain from that. Now, UV blocking glasses. Now, if I have a blue cat glasses, I wouldn't get this. If I'm using a special type of lens called blue cat lenses, they cut the UV radiations. So even though if I'm working in the sun and working maybe using a PC, I'll have the UV radiations coming to the eye, okay, coming to the eye, and they result in serious eye conditions. Mefa ewiem and as direct contact with the sun, because the sun has UV radiations. When they get into the eye, they're going to react. Not at the serious eye conditions about. Now, me simple glasses, a special type of glasses called blue cat glasses. So blue cat glasses, we know, the UV radiations to get into the eye. The ability to no get into the eye. A simple blue cat lenses. Getting a blue cat lenses here could prevent the UV light from having direct contact with the eye, and therefore it is going to prevent you from getting pterygium. Even though that's and then everything that because sunglasses and because of the blue cat glasses no one means a bit boa that kind of UV light radiations never in so and now say dust na airborne in so and now smoke even though smoke can penetrate a little, but at least it could serve as a very great avoidance of further pterygium. It's measure protecting the eye from UV associated eye disease. If you on UV and the pterygium bar. Now and get a special type of lenses. It is called blue cat lenses. It prevents you from that. Now it's blue rays, blue light control. Now you see a laptop, or phone, with TV, or light about them. All these are very, very dangerous. And when it comes into direct contact with the eye, it causes serious eye problem. And to those who are multi-piecing constantly, you're not protecting the eye, we are constantly giving yourself to blue light. And blue light is going to have a direct contact with the eye, react, and later in life, bring you a lot of problems. And I would advise you that anyone using PC, please get blue cut lenses. We refract you, we give you the appropriate blue cut lenses, and it's going to say blue light coming from PC, not a young one coming from PC. It goes to having a glasses, the blue light, it goes back. It doesn't get into the eye. It's messed up because when the UV gets into the eye, it could cause serious eye condition. Now, UV eye disease. This is as a result of UV. One, pterygium. I can't want to say that. Pterygium, when I'm saying, we are to move at the bar. Cataract, cataract, this is the cataract. This is someone with a normal eye, any cataract, but when we develop it, when that happens, your vision here becomes impaired. You wouldn't see appropriately. And then UV light can cause that. Meaning so from somewhere in the age of 40 years, you will develop cataract, especially more and more diabetes, quite there, but on the normal circumstance or on daily basis, UV radiations can make you get it faster. So please, you need to be aware that UV radiations and so it may cause all this kind of cataract. And or say a crime so a boy who buy from getting all this UV light into the eye. Now, UV can also cause age-related macular degeneration. Arabia, any obia or normal vision, no, say no one there. Near age-related macular degeneration, also vision be blurry. Ni nan UV light, it may speed up this kind of process. Eye cancer. UV light can also result in eye cancer. So I have a picture here showing eye cancer. Too much exposure. Who expose when to area, to PC, phones, now phone brightness eye higher. More of UV is going to the eye, going to react and give you serious eye conditions. With TV, it's too much. I'll say much crap from you. And all when say what damn light, any white light be won't say white light, white light, is very dangerous. And if you're coming into contact with any of these, make sure at least you protect the eye. You get this kind of blue cut lenses, and it's going to help you a lot. And can you be developing because of brain. Now, let's go to this question. Why spectacles instead of drugs? I think that most of the people ask this question that, I claim for the make you cry there. You come mommy space, and you come mommy say, and now your mommy do space never more. But what I want you to understand, and in you say, and yet Arabiana yema spectacles. Not every eye disease translates into spectacles. And yet eye disease biana mask until go hospital and French dream say, spectacles. No, it's never like that. It is only mostly due to refractive errors, because refractive errors demand refractive devices. Refractive error. Those things are refractive errors. And not the economy a draw bucket ma cra emanenko. So refractive errors cannot be treated with drugs. No. Into na yama lenses bisa. Emano nya say, ye pesike bi na age ana say bia wem do kwaya kuma space. Intine bia o call eye clinic won call dia enen pacho because ye bia na o condition no kra no enye refractive error. Intimacy say say glasses pe and a bit may treat refractive error. Any other drug, a drug beyond the honoma, a bit may treat it is spectacles can be used. Intimacy for refractive errors there, spectacles and a treaty. But any other conditions, a drug bit me up and palm may treaty. Now, this is the lens and this is a drug. Into these lenses purely for refractive error. And I'm me say, and your obia or just pets bien and one. It could be say that person or protected the like in terms of the UV lights or protected the eye. So be a UV light and give serious eye condition. And here one. Obiso especially lenses are maybe probably due to a refractive error. And that person took can give me lenses. And at 3, Obiso one man over opia we are maybe no papa. Until some man lenses be a bit me a doom. And a man a bit me doom kakra. Now feel comfortable. Until we wear spectacles for comfort. Yes, spectacles for refractive error. Say correct it. Refractive error. She has the one I see. She glasses for see. We are blurry. But with glasses, no, at any moment. You can also go into surgery. But the point I want to establish here is say, yeah, man spectacles are. It means say for refractive error, a patch say that kind of error no, a drew into me manenko. But say the some say, obia and I'm just person make a cum, and I'm menino a bay and it is never like that. Obu no ma wo hu ade yi papa enti man glasses bia ebema adekodane aya kese enti hwe nipa no from behind and also hwe nipa no free nim na hwe glasses nim na hwe nipa nso ani a obu won se nipa nso ani aya kese it doesn't necessarily mean say amma nipa no ani aya kese. All right, now where refractive error, I think we're almost done. Where refractive error any enti before se me hu ade me hu ni ye no I was set image now me a falling on a point called the retina. I was said just say and that's why me want to could ye. In terms of myopia, or be short sighted no. Where any and that way so a when moon until only plan don't want no any papa sa. When so sa only say that's no atra on so who are there sa when so that's no achia. When we are from refractive error. Before I can see everything and see it very well, no, I was set meaning I didn't have a mention a quadra on the yellow part. That's the retina. Sankoban is idea, then I need only lenses. A drone to my way and go. I need only lenses, spectacles to refract what I'm seeing onto the eye, the retina. But I'm can't be and I expect them in pedia. A one arm, I don't can bit much a drama. But a man in your wife I drew no. Every man at the because you can't come to the eye clinic and go back. I will say at least a man be a draw beer a bar next yeah now one yeah man was spectacles. Now say one pair. Obviously be a man. But a man in your wife I drew no a wako solve am problem amount there be. Now yeah say obia or yeah myopic. When you're refractive or obia short sighted. Are there a banner? When say we dey normal vision who ade oni who ade clear obi oye short sighted myopic ade ben na ohu at far no on say abe blur ohu ana obi hyperopic ade woni ma ohu e wo akira ohu ni clear sad conditions we and the spectacles treat a draw enti manenko say am kan we give spectacles to treat enti the treatment options enti for refractive errors. Treatment options. That more contact lens can help you to treat refractive error. And now spectacles, and now surgery. You trap when you know cornea and I know that's you trap free na ya reshape. If you are tie back. Anti adrobia say adrobia these options for refractive error. But then who say when in nature those ones they a draw and team manenko team fenshi team sa. These are the options. It has a contact lens, and now spectacles, and now surgery. But the surgery can cause a rebound effect. Because surgery now, it may cause a rebound effect. It may back, and even more dangerous form. Why don't you go by simple spectacles? Then you go your way. So we need to understand the fact that it is not every eye disease. And European spells who there be. There are refractive errors. And or one person protection. These are the conditions where spectacles. And if we need say, you call eye clinic, you finish your dream, say, I make a quiet, I want my spell, and to sada. That's the brain. Now, you share diabetic and hypertensive retinopathy. Something short very here. If you are diabetic, if you are hypertensive, or diabetes, or hypertension, Miss Slow, say, draw offer, then do that and manage it properly. And yes, sir, because only now a direct effect on the eye. I need something to say the eye is a sense organ born ma. I can look through to tell you if you are hypertensive. Me show any mama who. Me who any mama to me who. So I diabetic when you back at me. Me who any my sickle cell patient, sickle cell, bet my catch me. Met my here when you insulin level. Met me when you so refractive error. We are myopic. Ain't any no, it tells a lot. Now the eye no the extension of the brain. Why brain na actually about 7 is on? Into your eye is your brain. Because the eye extension when you brain be nice and about anymore as the eye. Because based on the ocular epidemiology and all that, ocular biology, and realize that the eye is an extension of the brain. Into whatever is happening in your vessel, because the eye is the only part of the body that but just a simple look, blood vessel. And independent who will be more giant in film, all this can manifest in the eye. If you are diabetic, if you are diabetic, it can manifest in the eye as diabetic retinopathy. And this diabetic retinopathy can cause vision loss. It can cause blindness. When you make fra, over diabetes, so making sure say managing ye. Over hypertension, also making sure say managing ye. And that's at the end of the day, no, hypertension, no, best sign for how we need. Best how kidney. Bebre, intimacy say, what people are far. I mean, the point is, what's how conditions we are manage them properly, managing ye. A draw is all fun, patria, benya, babyano, or so far. And you also yet to manage this kind of condition now, oh, yeah. And it's not just what in the same federal come you or same yes, say, man, you at the end of the day, no, it's going to result in serious eye damage. And not going to understand. And once we have this kind of diabetic retinopathy, it's very dangerous to manage, very difficult to manage. Intimacy say, in the mechanical way, Honoma, Mumayan so, na intimate refraining from it. Now, you have presbyopia. At the age of 40 years and above, at the age of 40 and above, Biano, we experience presbyopia. In penifo be now Honoma, or just space, onya 40 years ekwa. I didn't because they all say who are there when you it's initially, once or training something to or can't buy one or can't book because I was an insano, what check when you move. And at the point in time, maybe some 2 years to come and a year to come, no train when you move. So training sana and sana could see the incentive when you move. If you know or train here then or train to the battery because a person on a very long distance before whatever the person is looking, obey me. Interview obi or presbyopia, idea ben or high, blurry, but me correct no, but lenses are most of them who are clear. Now say at the age of 40 years, echo biano, ebekain. And ye obia from 40 years and above, you will experience this. Inti eduho near so amount glasses be to correct data. Don't hesitate. It's all you need to accept that because apart from that, nothing else can be done. All right. Now, you do be able to say, people want when you're 40 years, 50 years, yes, so they can read without glasses. It doesn't make sure, it doesn't really tell, say, monomony presbyopia, but they have a condition called myopia, extensive myopia. And this kind of extensive myopia, no, near say, nipa short-sighted, no, or no condition or one that no, even though the condition is bad, but one man who are there when you move into about 70 years, 80 years, now or so on there. Oh, I can read without my glasses. It doesn't mean say no any problem. Probably they are having myopia. They are really myopic patients. They are short-sighted. That is why they're able to read. And to understand the fact, say 40 years and above, we never can in back they draw. Now it goes to an eye clinic that's complaining that in patriotism, them who are there when you move, and one cry, and you moon a 70 me who say, and a basa. So we accept the correction. We accept the correction. Now, I think I'm almost done with my submission. A trick to instill eye drops when one is not responding to conventional way. Ideally, a person ma eye dropper. I was saying me be me nase, now me de go. but I am here be all basically when is nipping so every like on person will be in any year. Intimate good I'm a bread because on person will be in any year. So what can I do to help this patient? Okay. Let me talk about code. So this is the last slide. The last slide. Code and warm compress. Code and warm compress. This is the last slide I'll talk about. Code and warm compress. These are home remedies. Now the very first one I'll talk about is tie. This is tie. Unfriend, probably friend or this year. Now this is a very eye conditioner. Okay, are the mostly most of them are the lower eyelid. Once we say. Now, as a home remedy, even though drugs can help, but as a home remedy, you do warm compress. So whenever your child, whatever, is having this kind of problem called stye, do warm compress for that person. Warm compress, is saying you get, clean towel, very neat one, clean towel. Okay, and then you when you swallow, warm kakra. Then you dip that clean towel, then you dip that kind of towel into the bowl. Now if you watch him, now if you when you say because your glands be a produce cell, a produce glands. We have what I mean boomerang glands. A produce a oil onto the surface. Because ten piano, I was say a nino as a can say, I say a student kakra. Dry eyes. When that kind of glass is a blocky pet, now say glass the lipid aspect no and a money then as well as ano. Warm compressor a bit glass no ye now if you mind about out no relieved. Whenever you're experiencing any of these, make sure you do a warm compress. Warm compress, like I say, get a clean towel, get a bowl, pour an amount of warm water. Pour into that. Now, if anything, if you get into that, then you dip a towel and then you clean it very well. I think we're almost done. Now, when you experience eye allergies, and also sometimes everyone may come MY, it results in that. In terms of my eyes alone respond 10 times to that. It means so whenever you're experiencing any allergies, so I say when you see a cow, when you saw a cow, I say a prune so that I say so I call all the allergies. Make sure you do a cold compress, not warm compress. It's also by ice. Now there are two so kakra, not per clean towel, not a boom, not to so, and to help you to relieve all these kind of problems. Say a tire, so this year now do warm compress. Say a allergies be when it cow. I say so I call a prune so do cold compress. I think at this very juncture I would end here, and then maybe some other time because concept in the Dawson into all right. Concept in Dawson, but for now I will end here. I know that Nyati Biano Edebeye Eduma na it's me and so at the Abohaka. But your Mr. Do Jemfi Zakaria Pachibit Makasa.
Okay, but that's it. But now me think I can say okay say ebia long and a short sightedness now.
Okay.
Now lens correct now. What lens now for be so many years. Everything you correct no craft here. Enya say obesha lens ni bi mu ana. And I say
okay, Matase, that's be great. They say glasses no shine 20 years cry. Untim kasi with the machine lens now ache into a correct. Tuition 50 years cry now, you will still need the glasses. It doesn't correct. Into you can say the glasses no does not correct. It doesn't treat. It is used to manage. The glasses now in treat yeah, let's meet me at a point in time. I mean, your glasses need beam. But it manage it, which means say you would need the glasses to because glasses and a direct light rays, no, adequate to baby say 1 day. A direct light rays, no, adequate to it's a me year. light rays no enkoto ye into some measure glasses there au measure minting glass machine 10 years until by now there glasses na measure no according to me to me yeah I'll see things clear there be so you wear it throughout. Please, are you okay? Hello. Hello.
Hello, Doc. I'm Matthias.
Right. Pacho, me say be epijamansa, and you can unmute yourself and then you ask if you have any question.
Thank you very much for your nice presentation. In fact,
you're welcome.
Very, very educated.
Thank
now,
you.
may me buta question be mami nuembi. Surgery.
Okay.
Cataract surgery.
Okay.
Enti, edebe preventive measures. Or you nipa bi a so ade kwechima.
Okay.
Na wakoye.
Okay.
Me busa say then na wetimi abo say ni na ya an operation no.
Okay. That's baby. It's near tell cataract surgery say lens bu eni eyi na ye de foforo ahye ama ebi so kwa ya mama fake ya mfa hwenhye but unyanye cataract surgery na e was say obo ehun ban enti also ade kwa chima sometimes it becomes a bit of discomfort na minim say if it is the daytime there and can normal circumstance cataract say mpacho wedding face saying
This year no benya 40 years.
40 years. Okay. It is near 10 say pa okwa wiemu a because sunlight contributes to that. It is okwa wiemu a the bayan konya a special type of lens before the photochromic lens a ebe boano. Same be even say sun here very scorching or tompe oduro wiemu a the brightness no ebe reduce automatically. Even though when you say light rays no and our sun is very scorching, very brighter, the photochromic lens will actually reduce the amount of light the person is seeing, and always there'll be comfortability. Until onya photochromic lens which me ashe that one, especially say one eye no yeah surgery no, and the other eye no onya surgery na or share this kind of lens na better protect the other eye no from developing cataract again at the same time because the one ma or develop it on the left eye. Yeah man later no saying on the right eye. Now when you back on when protecting both eyes now back on kobenya a bit check and sana wenya. I will recommend say obenya a photochromic lens. Can be at least even the whole time there it seems a little bit of discomfort. So all time there now glasses no essential no. Emma and no and have you be brave. When you get kind of photochromic lens ebe buano na fe direct sun rays na air bano the other eye na and sign na no oba ebe san prevent it from developing cataract na fe wetimi so ameno so achaman. It's a very simple one. Get a lens bia a bit me that's photochromic lens a bit me abua mostly no cataract no we na okoyi no say yam fe bi man shema na the left eye no say yam fan shemua ko bo e shy eyi ma wa yam fe shim yam fa ni wan shim ebi so a the more artificial one say ebi nshemu dia and bit me and without wearing the spectacles now already that you eat a lot of vitamin C as an antioxidant with the vegetables into one option is say obeti me upper glasses I share as a photochromic lens and now say obi make sure say obi take supplements. For example, a drug called icopene, a drug for the icopene. And what I want to mean the vegetables and some of my year with icopene now, a bit more antioxidants. So antioxidants no, the light rays nearby and they fight against the UV in the light rays. It's a very too simple method. Obit me now a lens called photochromic lens, and I say only fruits now taking much more vegetables.
Okay, thank you very much.
You're welcome. However, after this one, we can.
Thank you very much.
Contact directly. Okay.
I don't know whether what you mean. Masen Bisani did kind of say, I don't know whether you've touched on it. When we say our daily lives and day in and day out, you know, especially with now sometimes a wuro and those things in the coin in kakra.
Yes.
I don't know what effects
Yes.
would that give to the eye.
All right.
I feel that the blue 40 and once I'm to draw attention. What can you do? And then it was here because as at now, won't be any one day. I mean, measures been in tiki. Now, as the blue 40 in economy. Thank you very much.
That's very. Now, I'll talk on the first one. First one, I'm talking about a huro, any others a coin. It is very dangerous. Into your assets and your basis. Our certain piano, the eye should be neutral. Into the huro basic, it is going to cause a serious damage. And perfume, spray, car batteries, cement, any other chemicals, it is very dangerous. I recently make sure picture be nakawahe. It's mesel we call something irrigation. Something work on now or now what if or samana. Ni bia koneni, bona perfume bia koneni na waja honom sa debi anytime anything chemical goes into the eye, whether acidic or basic, make sure you do eye irrigation. Penso bucket half kwana bioni no, it should be under running water na ubukusu sa for about 10 to 15 minutes. That is called eye irrigation. Whenever perfume, any other thing, any anything so now you do eye irrigation constantly and can normal circumstance at the clinical level no, I'll use normal saline and I'll say via ringus lactate you better irrigate them. But say if you as a home remedy no, make sure you get about half a bucket. So running water so dia for any coho na baby at the kodigu yano be na in so bu pipe buku so 10 minutes because that thing can cause serious damage. Initially we should but one man na san kawo feel discomfort. So anytime any chemical gets into the eye, whether allow penio, make sure you do irrigation, get a lot of water and flush the eye. And when you do that, after that you can get some kind of antibiotic. Na be gentamicin be neja na de buskakra na kama. But for the irrigation, the moment it goes in there, then you do irrigation. I think you have less than a minute here. It will come back, like you come back again, by back off, because you come back again. So that is that for the whenever acid